Good morning, everyone. It is a pleasure to present my project entitled Recruit, Retain, and Reach, Increasing the Black Physician Pipeline. Next slide. Did you know that there has been a stagnant growth in the enrollment of Black medical students over the last 40 years? Black physicians still account for only 5% of all physicians in the US population. Black and African-American applicants constitute only 8.4% of the US medical school applicant pool compared to the 46.8% of white applicants. And this is according to the report of the Diversity in Medicine Facts and Figures of 2019. Did you know that there are more positive health outcomes when Black doctors take care of Black patients? Did you know that Black and Brown communities have a greater incidence of poor health outcomes due to the lack of access to healthcare? Did you know that Black physicians are more likely to work in underserved communities and work on research topics relevant to the health of Black communities? Next slide. Also, did you know that nationally Blacks have died 2.5 times the rate of whites related to COVID-19? COVID-19 has not only threatened Black communities, but it has also threatened Black healthcare workers, which directly impact the Black physician workforce. Next slide. As a Black female physician, I can personally identify with challenges and the need to create Black future doctors. Although this is not me on the left, it is a depiction of me as a Black girl dreaming of becoming a doctor just like Dr. McStuffin. Now on the right is actually me administering COVID vaccines earlier this year to a gym in Southeast Raleigh, close to the high school which I attended, a zip code heavily impacted by COVID-19 deaths. It was powerful to see the Black and Brown community embrace us and how much they appreciated seeing healthcare workers that actually look like them. We symbolized hope and trust. So this is my why for this project, exploring ways to increase Black physicians to help close this health disparity gap in our country. Next slide. The objectives of my project were to learn more about the various medical programs for Black youth, identify barriers and challenges around these programs, strategic planning to make these programs more successful, and to bring about awareness of the need to recruit, retain, and increase the Black physician pipeline. Next slide. Over several decades, there have been many, many layers that have contributed to the drought of this pipeline. Early this year, the American Medical Association, the AMA, put out a newsletter in January 2021 that addressed the need with an article entitled, How to Get Up to 3,000 More Black People in the Physician Pipeline. I decided to address the barrier, the last one, which is lack of early exposure to the medical field and mentorship programs. I arrived at my focus by hearing from Black physicians in the community. Next slide. Part one of my project, Methods, I surveyed Black physicians in the community to really learn about his or her journey. I surveyed 10, 5 males, 5 females, and they range from primary care to specialists. Next slide. Although it was a small survey pool, it really helped to target my focus. 10 of 10 developed an interest for medicine well before college. And 10 of 10 thought that the summer medical program and mentorship programs were key elements that paved the way for them to becoming a physician. Next slide. One surveyed physician even quoted this: "We have to get downstream and get more kids interested in healthcare in secondary school. We need those kids to be exposed to physicians who look like them and can open their eyes to the potential of healthcare as a profession. We need to support pipeline programs, provide summer programs, and scholarship opportunities. Many Black and brown kids simply have not seen doctors who look like them, so can't see themselves as physicians. So this reinforced the topic of concentrating on medical programs for young Black students and emphasized the need for strong mentorship programs. Next slide. So this led to my second part of the methods. The second part, I had an opportunity to set up an interview with someone from each of the North Carolina medical schools, from Duke, Wake Forest, UNC, and ECU. My focus was on diversity, equity, and inclusion staff members. We discussed the medical program specifically for elementary, middle, and high schools. We discussed barriers, strategies. I learned more about their specific programs, and I was glad to learn that each medical school had an emphasis on mentorship. Next slide. The results from all the medical schools were compiled in a chart. By the time I got to the fourth interview, it was very evident that the medical schools shared similar barriers around three categories: students, funding, and community educators. Similar themes were among the Black students. There was more negative an image around towards the STEM programs and a lack of Black role models. Especially with the COVID-19 pandemic, there was a major issue with funding, as well as trying to establish a safe environment, yet meaningful curriculum during the pandemic, and especially with limited funding sources. Funding continues to be a major program, especially for these early age students. Some funders, they really want to see a quicker return on investment and tend to focus on the college and pre-med level programs. As mentioned earlier, it is important to spark that interest of students in the secondary schools and put them on a path of medicine in their early years. Thirdly, the educators. Educators in the school system and the community are not always aware of the various medical programs, including application deadlines, etc. Therefore, the information is not shared with potential students and parents in the community. Next slide. It is important to first identify barriers in order to actually develop strategies. The strategies are here in red. Make the programs more fun and exciting to overcome that negative stigma or image of the STEM programs and medical programs. Utilize virtual hybrid platforms to reach more students at a lower cost. And keep the parents engaged in the programs will only enhance and encourage full participation from students. Explore funding sources outside of the medical school, including community outreach grants. The medical schools need to develop strong relations and partnerships with the local schools and other community-based programs to maximize early exposure to medicine. Next slide. And in summary, it will take work from all players, including the community leaders, healthcare workers, doctors, local schools, and medical schools collectively in order to make the important impact of the success of medical programs for the younger school age groups. We must be intentional and pay it forward and serve as role models, mentors, and actually share the resources that are available. The medical schools should collaborate and have more career fairs at the elementary, middle, and high schools to even market their various medical programs unique to the medical school. And finally, this was one thing that really resounded with my interviews. One faculty said, "Don't forget the C students. Give them the same opportunities as the gifted and talented students that make A's and B's. Push and encourage all students, especially if they have a passion for medicine. You never know the impact that you'll have on young individuals." Next slide. And I'd like to acknowledge all of those that helped contribute to my interviews, the North Carolina Medical School faculty, for taking the time to meet with me virtually and have discussions around barriers and ways to strengthen and increase the Black physician pipeline, especially within North Carolina. Thank you.